Hello and good evening again. Thank you for joining us on this webinar. It is my pleasure to now pass the lead over to Veronica Brown, our National Account Manager with DSG for all of Canada.
Great. Thank you so much, Jessica, and welcome everyone this evening. I'm honored to introduce to you tonight Andreas Klie. Andreas has over 30 years experience as a registered dental technologist. Andreas has experience as a previous dental lab owner, as well as working in sales. Andreas' position with Panthera is the Regional Sales Director for Ontario. Andreas, please go ahead.
Thank you very much, Veronica. Well, good evening, everyone. Really good to be here. So welcome, and going to have a really fun-filled evening and informational seminar tonight. So the plan for tonight is who is Panthera Dental? I'll briefly go through who we are. And then Dr. John Viviano will be talking about the benefits of the 3D printed CAD-CAM technology, Nylon, and the DSAD. And also by Dr. John Viviano, the DSAD patient and design selection. And to conclude, I'll summarize everything right at the end. So who is Panthera Dental? We are a Canadian-based company based in Quebec City with subsidiaries in the USA and France. We are one of the world leaders in custom-made dental solutions. We have 3 divisions: the Panthera Dental, which offers all the implant, prosthetic, restorative options. Of course, the Panthera Sleep. It's the topic we're going to be talking about tonight, offering the Nylon mandibular advancement devices. And one of our newest additions is the Panthera Implant, which is the division where we have our new CAD-CAM subperiosteal implant. We're on the cutting edge of CAD-CAM technology and printing technology with a high precision industrial manufacturing facility, and everything that we do at Panthera is using proprietary software and technology. And the picture that you see here in front of you is our new building. We moved in January, very proud to have this new facility. It's a state-of-the-art facility. If you ever get a chance to come to Quebec City, really worth the trip. As I'd mentioned, everything that we do at Panthera, it's all proprietary software, both in design and manufacturing. And this is a culmination of 10 years of R&D within Panthera. So be it for the Panthera Dental, Panthera Sleep, and Panthera Implant, everything is proprietary. And with that, I'd like to start the evening and hand over to Dr. John Viviano. And Joanne, if you wouldn't mind introducing Dr. Viviano.
Thank you, Andreas. There's a poll now. Please answer if you can. We'd appreciate it. And then I will introduce Dr. Viviano. Give you a couple of minutes, seconds.
And we'll share results. So delivered any sleep or snoring appliances at 88%. Dr. Viviano, you are in working mode. And while we're waiting for the next one, we'll just launch the second polling. It is a 2-part question. Have you delivered a 3D printed nylon appliance? And are you aware of the benefits of a 3D printed nylon appliance? We'll just give this a few seconds, and you are in presentation mode, Dr. Viviano. And a couple more seconds here. Woo, a lot of attention coming in this evening. Thank you, everybody, for participating. This really helps all of us get a grasp on where you're coming from, especially your expertise. So a couple more. We're at 30 seconds, so we will end and share results. So we've got a mixed crowd on having delivered. We do have some looking to learn more. And as far as being aware of the benefits of a 3D nylon appliance, you're at a 40%, 20%, and 36% wish to learn more today.
I guess that's where I come in.
My pleasure to introduce Dr. John Viviano. Thank you for attending our webinar tonight. Dental Services Group Laboratory is a group of full-service dental labs throughout North America, and we've been helping dental teams initiate and successfully implement dental sleep medicine into their practices for more than 25 years. My name is Joanne Friedman, and I'm with the Canadian DSG Labs based in Toronto. My colleague Veronica Brown is based in Ottawa, and together we service our customers throughout Canada. We are happy to help guide you through the dental sleep journey. In the follow-up handout, we will also provide the contacts for all our USA-based colleagues as well. It's my pleasure to introduce Dr. John Viviano. We have worked together for many years, and I'm always learning something new from him. He is extremely knowledgeable, evidence-based, and passionate about dental sleep medicine. Dr. Viviano is always willing to share and help further the practice of dental sleep medicine. Dr. Viviano obtained his credentials from the University of Toronto in 1983. His clinic is limited to managing sleep-disordered breathing and sleep-related bruxism. He's a credentialed diplomat of the American Board of Dental Sleep Medicine and has lectured internationally, conducted original research, and authored original articles on the management of sleep-disordered breathing. His clinic is the first Canadian facility accredited by the American Academy of Dental Sleep Medicine, and he is clinical director of the Sleep Disorders Dentistry Research and Learning Center. He also hosts the Sleep Disorders Dentistry LinkedIn discussion group and conducts dental sleep medicine CE programs, both online at stdacademycom and in class for various levels of experience, including a 4-day mini residency. John?
Thank you, Joanne, and thank you, Andreas, for asking me to participate in this. Let's see if my clicker works. And of course it doesn't, so we'll do it the old-fashioned way. So I like doing this at the beginning. Here's just a picture of my office and my CE center where we have courses and have a lot of fun there. So if you're ever around, step in, that would be wonderful. By way of disclosure, I have no vested interest in any appliance, device, or technology. I maintain a sleep disorders dentistry practice, conduct research, provide educational programs. Facility is accredited by the AADSM, and the facility and all programs follow AADSM, AASM guidelines. So objectives today, and I got a ton to cover in the time I've got, so I'm gonna go a bit quick, but it's okay because this will be archived. You'll be able to watch it again online, and please feel free to email me and reach out if you have any questions about anything I talk about. So benefits of 3D printed CAD-CAM technology, benefits of 3D printed nylon, benefits of the DSAD, size, durability, design in particular. And then we'll talk about patient selection, design selection, and I'm gonna give you some tips and tricks at the end. So computer assisted design and manufacture allows quick innovation and development. You have to understand, prior to 2013 or thereabouts, I mean, this was unknown to any of us here in North America. And if you got a version of an appliance, you were stuck with that version of the appliance for a number of years until they, went through all the product that they had paid to develop and manufacture, and then they could revise it based on feedback they were getting. Well, the beauty here is that they can do this on the fly. And as a result, these devices, the CAD-CAM produced devices, have been modified continuously from the day they're introduced. And that's amazing because as we use these devices, we give feedback to the manufacturers and they are constantly tweaking things and devising improvements that will help us do a better job with our patients. And it's done, I'm going to say, as close to real time as it can be. Now, what they use with the DSAD appliance is type 12 polyimide nylon polymer, and it's a laser sintered manufacturing. It's printed from the inside out in 50 micron exactness. Strong, comfortable, compliant. It's consistent in its production. Predictable manufacturing, of course, leads to reduced adjustments in share time. And it's a hypoallergenic material used in medical applications already prior to being introduced to oral appliances. Now, the digital storage capabilities allows additional or replacement devices to be made without taking new impressions. And this is a great benefit. Achilles heel, of course, is that nylon's not repairable, but it comes with a 3-year warranty on breakage. Now, type 12 polyimide nylon itself is It's really interesting. You know, when it was first introduced, I literally laughed in the face of the ResMed rep that was showing me the new Narval appliance that was coming to North America. And that was because honestly, I had no appreciation at all for what this nylon was. It really looked flimsy and inconsequential as an appliance. And I thought it looked very toy-like. However, when I went to industry and I looked up type 12 polyamide nylon, this has nothing to do with dentistry. This is just general industry. And I looked up the qualities of this material. Absorbs very little moisture. Do you think that might come in handy for an oral appliance? Excellent impact and non-impact strength. Think about your bruxers. Excellent resistance to chemicals. Think about your GERD patients. Excellent resistance to cracking under stress, including when used to encapsulate components. This is not taken from a dental journal. This is used in industry for this purpose. Excellent resistance to abrasion. Think about bruxers. Low dry run coefficient of friction. Well, this is when it rubs up against the soft tissue, the mucosa. Low friction. Very handy. Dampens noise and vibration. Think about the clattering sound, that denture clattering sound that sometimes patients complain about with acrylic appliances. Fatigue resistance and with a high frequency cyclical load. Well, think about those repetitive lateral bruxers. Highly processable. This is something else that makes it exceptional because the same material has different characteristics and qualities depending on the thickness. So the same material can be used for the body of the appliance. It's used as the retentive component of the appliance. It's used as the strap to advance the jaw. It's all the same material. So it's highly processable and has different characteristics depending on how thick it is. Well, we look on and go on to size as one of the benefits. This study in comparison was done several years ago, actually with the Narval appliance, but it's a similar footprint. So we go from nylon to the tap to the Hearst to the Somnodent. You can see the increase in volume, an increase in mass. However, the density remains very similar. Okay. This was a patient that presented. He had ear-to-ear crowns done overseas. Was not happy with the aesthetics, and so he was thinking about going back and having it all replaced. So that was on the to-do list. This poses a problem if we want to make an appliance for him. The gentleman was CPAP intolerant. He loved the nylon appliance that I showed him, but based on the fact that he was thinking about having all his dentistry redone, we decided to proceed with an acrylic appliance that I could then reline for him should he decide to do that with his teeth. Okay. However, he couldn't tolerate wearing it. Sent it back to the lab and had the lab reduce it in size as much as they possibly could without compromising the structural integrity. It delivered it again, couldn't tolerate wearing it. Came in tears. Now this gentleman towered over me. When somebody towering over you is in tears, eyes welling up, you realize that you need to do something. The gentleman's in distress. So I remade the appliance for him. I made him a nylon appliance, and he resolved his issue, was working well for him. He's very happy. Now, when you take a look here at the Herbst that I made him, that's the blue one, compared to my office sample Herbst, it gives you an idea of the size of his arch. He was a huge man. Now, look at the nylon appliance at the time it was a Narval. Look at the size of his nylon appliance compared to the office sample. So we think about these appliances being useful in petite people with small mouths. Here's a perfect example of somebody with a very large dentition that could not tolerate the bulk that was necessary to create the structural integrity that we need with the acrylic. And well, in that particular case, it was a Narval, but it could be a DSAD, any nylon appliance. We're speaking specifically nylon right now, you know, could be much more accommodating for his needs. This particular gentleman, also CPAP intolerant, had acrylic appliance made for him by another clinician, and it broke within a year. And he came in to see me and asked me, is there anything else? I like the concept. I couldn't tolerate CPAP. I can wear an appliance, but is there anything stronger? So we made him a nylon appliance. And you can see it resolved his issue. And we actually repaired his acrylic appliance so that he had it as a backup. And he went home and he decided to leave it on his bedside table, which allowed his dog Luke to put it to the durability test. So Luke got a hold of both appliances and they sort of had it out and tossed them, big tussle and everything. And at the end, Luke didn't come out looking much different at all, but the acrylic appliance and the nylon appliance both seen better days. Now, what happened was he came in with these two damaged appliances. With the nylon appliance, I was able to trim away the damaged part, disinfected it, give it back to him. And the acrylic appliance was so fractured, it had to be tossed. I called him the next day. My wife is happy, no snoring. I had a restful night's sleep. The appliance was as comfortable as before. So this was a win, right? Now, of course, I posted this online on my blog, and there was some naysayers saying, well, the dog didn't like the taste of the nylon, or the dog preferred the taste of the acrylic, or the dog gave the nylon appliance a pass. Well, let's take a look here. This was a close-up picture of the dorsal appliance. And you can see it had a soft liner, multiple cracks. There isn't a lab in the world that would advise to repair this appliance. It had to be tossed. And when you look at his nylon appliance, you can see the chew marks all the way around. The dog was using it as a chew toy. It actually got the better of it in this one spot, and I just drilled that away, cleaned it up, disinfected it, gave it back to the patient, and life went on. So it really was put to the test by Luke. Now, we talk about design, but I need to cover a couple of basics that's not talked about too often. Okay, one of them is horizontal versus oblique forces, and the other one is compression versus traction propulsion. And what I mean by propulsion is the method with which the jaw is being moved forward. Okay, so let's take a look at force vectors first. If they're in the same plane, for example, horizontal, right? These forces are actually additive in nature. However, if they're in the oblique plane to the mandible moving forward, then what happens is you have to follow Pythagorean theorem. And with Pythagorean theorem, the net result is a 41% increase in force to get the same job done. So the oblique force turns out to be 41% higher than if it was just horizontal. Okay, so that's something to keep in mind. Another thing to keep in mind is compression. So we've got a stiff rod pushing the jaw forward. So it's being propulsed forward by compression, as opposed to traction, where it's being pulled forward with an elastic type or forgiving type of strap. Well, lateral force on a compression type device, basically the lateral force follows the direction of the material's reaction. So it's adding to the force vector going obliquely forward. Interestingly, when there's traction, it divides backward and forward. So the net result is basically oblique compression propulsion, Herbst style propulsion, results in higher concentration of forces than horizontal traction to get the same job done. Now, we don't have time to talk about all the different styles of appliances, but you need to know that the DSAD appliance is a horizontal traction, and these factors actually impact on the required dentition, which dentition are most important for retention, factors that you take into consideration on delivery, calibration, and maintenance. So the DSAD is a bilateral hinge, one hinge on either side. It's attached, but it's movable. and it's a bi-block type of appliance. And we can see here that there's a lifting force at the posterior area. So which is why it's so important to have good retention on the mandibular molars. Also why you end up with open contacts in the posterior, because every time you go to open your mouth and that lifting force there is pulling upward with that wedge of nylon that's retentive and in between the teeth. So the force is there to, open up the contacts. Happens to varying degrees because patients do that to varying degrees. Some people brux a lot, some people open, some people don't. It's different for everyone. Now, the other good thing about this type of force is there's a jaw closing tendency, which of course is helpful. Okay. Now, when we look at some work that was done back in 2006, comparing the horizontal traction versus the oblique compression, compared to Herbst to at that time, a Narval appliance, which is the same design style as the DSAD, right? This design, horizontal traction, resulted in less TMJ stress, less masseter and posterior temporalis muscle activity, and encouraged mouth closure. These are out of the conclusions for that particular study. Now, vertical dimension opening is unrestrained, so the patient can open and close. You can use elastics to help maintain jaw closures for those people that do have a jaw that drops open when they're supine. Now, personal observation on my part, the appliance design has tooth movement implications, and we'll be talking a little bit about that. Now, selection. Ideal for deep overbite, requires a minimum vertical open dimension. You need strong maxillary cuspid and bicuspids because the strap attaches here and goes further back to the posterior molar area or just above with that little attachment mechanism. So you need to have good solid cuspids and bicuspids. Strong posterior mandibular teeth that are nice and bulbous that you could grab onto and get some good retention. Posterior maxillary can be edentulous, doesn't matter. Good for large tongues, small, or as we learned from that case I showed you earlier, large mouths, future anterior dentistry of vulnerable anterior teeth. You can skirt those teeth completely and have the appliance not touch them whatsoever. Good for lateral bruxism. There's plenty of movement laterally. Good for claustrophobic patients because literally the footprint on it is so small. And of course allows mouth opening, which is helpful for claustrophobic patients and promotes jaw closure. Now on delivery, if you have posterior support, you need to ensure it's balanced. Okay? If there's no posterior support, ensure you're not having unilateral contact or one side only, or you will have side effects. If the jaw feels like it's being pulled to the right or the left, sometimes that can be corrected by balancing the support. Other times you could just use a different strap size to manage that issue. It depends on how much the patient deviates to the left or right. Now, patient selection. Female patients or patients with small oral cavities, apparently those with large arches as well. Anterior dental work that you wish to avoid. Future anterior dental work. So they need new crowns, but they really don't want to foot the bill for that right now, but they need their appliance today. You know, you can do that. Anterior sensitivity. So you can avoid touching the anterior teeth whatsoever. The appliance engages the teeth from the cuspid backwards on the maxilla. Okay. Adverse to metallic appliances. Some people don't like seeing a lot of metal on an appliance that they're going to be putting in their mouth, or they could legitimately have allergic restrictions. Achilles heel must ensure adequate retentive dentition. So the most important critical dentition is posterior maxillary. You have to make sure that you can grab onto those teeth well. So there's the anterior band when we talk about design, and it can be designed different ways. The Panthera folks have given us a plethora of different designs. You can have the strap on the labial, on the palatal, wrapping around 3/4, the whole rate. Oh, you can have, by the way, full contact if you want in the front, or you can have it skirting the teeth all the way around. Okay, so they give you plenty to choose from. This impacts on retention, tooth movement, and tongue and frenum irritation. So just, keep in mind the patient that you're putting it in. The bottom line is this. For me, I have a favorite go-to anterior strap that I think provides me the most security with regards to tooth movement, and it's this strap here. I like the lingual to be protecting, or the palatal and the lingual to be protected with nylon, and I like it to wrap around because it gives more rigidity. This helps with retention, and I think helps to minimize any torquing of the appliance, which could lead to horizontal tooth movement, but also helps with something else that I discovered very early in the game with an appliance that had straps just on the labial. This individual ended up with a diastoma in 2014, and it was something that I saw off and on, and I had difficulty understanding why it was that only some patients, and I myself ended up with a diastoma after wearing the nylon appliance for a number of years, which is now mostly closed up. And then I finally realized that, well, it depends on your original starting position. Your extreme class 1 or 2 or 3, as you move the jaw forward, that's going to vary, of course, from patient to patient. That tongue is going to be pressing up against the palatal of the uppers to varying degrees. If you're a class 2 and you advance a bit, you're not going to be putting much pressure there. But if you start off as a class 1 or a class 3 and you advance substantially, your tongue is going to be pressing up against the palatal of the upper incisors. Now, unless these teeth are going to defy physics, that type of pressure could lead to anteriorization and opening up of this diastoma. Now, I don't have proof of this aside from the fact that the moment I stopped using the band in the front that wasn't giving that protection on the lingual, this went away. Okay, for this particular patient, I had made this appliance here, inserted in April. There was a diastoma by July. I remade the appliance, and she also had a Brux appliance that fit on the upper. So when she put her Brux appliance in, it would push the diastoma closed, right? So I had her wear her Brux appliance around the house on a daily basis for about an hour, right? And through this time period, from August, by November, the diastoma was gone. She didn't have to continue using the Brux appliance. Once we corrected, the diastoma was gone. It never came back. So once protection was placed there so that tongue couldn't be pushing those teeth forward, the problem was resolved. Okay, so that is my go-to strap that I use in the vast majority of cases. So now we get to the body of the appliance, so what they call the plateau. So there's a lower and an upper plateau that, one rests on top of the other, and you can see you can have lateral contact, full contact, or anterior contact, and it depends on your personal preference. Okay, now I like using this anterior contact, and the reason is, especially if we're dealing with heavy bruxers and people that complain about having muscle tension in the morning or headaches, because we know with an anterior midpoint discluding stop, right, temporalis muscle activity reduces about 75%, and masseter muscle activity reduces by 55%. So why not provide that? I can't do anything to get them to stop bruxing, but I can do something to get the amount of muscle activity to be reduced while they're bruxing. So that is why I like this particular design. So design features, and this is all on the prescription pad. You can pick your selection of where your bite is and whether you plan on moving forward substantially for here, how much, whether you want to move back or move forward. And keep in mind that there's about 9.5 millimeters of advancement straps available to you, but the design of the appliance takes into consideration this information so it can be optimally manufactured, right, to work best. And so depending on how you plan on protruding and where you plan on having your starting position, you should indicate that on the prescription. Okay. Vertical spacing, they'd like to know whether it's okay to change it up to make it more optimal. You don't need much in the way of vertical between the upper and lower component because this is very thin material. They like to know whether the protrusion is straight and elastic grooves. I routinely ask for elastic grooves on all my appliances. Whether I end up using elastics in the case or not, it's always nicer and cleaner and neater if they put the grooves on there rather than me trying to drill them in afterwards. Also, they like to know if there's fragile teeth and crown and bridge, and there's other things too, like a composite button, which I will be showing you in a bit, or other options like distal wrap you can indicate. Okay. This company is very good at listening to your requests. Now, tips and tricks. We're getting near the end here. Adjusting nylon appliances. When I was first introduced to nylon, I didn't know what it was. I thought it would all shrivel up in my hand if I tried to adjust something. It doesn't. But definitely practice on one before you start doing this with a patient's appliance. Basically, use your acrylic burrs. But unlike acrylic, you can't add it if you've removed too much. So adjust in small increments. As far as polishing goes, Fabulustre works fabulous along with some felt discs. I like using the Ergoden polishing discs. It comes in white, gray, and brown, and then the blue or the turquoise one has got impregnated polishing paste in it, and it really puts a nice shine on the appliance after if you've adjusted it. If you just adjust it with your acrylic burr and leave it at that, you'll see chatter marks on it. You'll see like a furry finish, but you use these discs on there and you'll get it polished up. It'll look just as nice as when it was first sent to you. Now, I'm sure you all know the Hilliard plier trick to use on Essex trays. Well, the same thing can be done here with a nylon appliance. Just heat it up a bit and place it on there. There's the More Practical Pearl ebook that's a free download from my website. Gives you detailed instruction on how to do that safely. This is the buttons that I mentioned earlier. Okay. The good news is that you don't have to use these things often, but if you have a situation where you really want to make a nylon appliance, but the molars do not have the proper retention, you can do it. You can simply add buttons beforehand and take your impression, or you can have the lab optimally put the divots inside the appliance when they manufacture it, and then you actually put the composite in place once you have the appliance as a template. And it's interesting, you prime bond, put the composite in, place the appliance, and you cure the resin through the appliance. It's really quite fascinating, and it works great. Other way, if you've got an appliance that used to be retentive but has lost its retention, just heat it up a bit, give it a little pinch, and then hold it in some cold water or underneath a tap. Fitting around new dentistry. Okay, well, if it's just a minor adjustment, it won't be a problem. Somebody has a new resin placed, a new crown, and it's one tooth, especially if it's not a critical tooth, it's really rarely an issue. Problem is, sometimes you can have a situation where somebody loses a crown. In this particular case, one of my patients lost a crown that was very critical, it was a mandibular molar. That was absolutely essential for retention. So the appliance was less than a year old, and it was critical that we made something that fit under it well. Otherwise, that appliance would be toast, and I'd have to make a new appliance after making his new crown. So I took some polyvinyl, took an impression of the inside of the appliance, sent the impression of the tooth prep to the lab, and asked them to replicate the crown that used to be there. Went in, no adjustment whatsoever. The appliance went in and everything was fine. This is, I believe, the last tip. What we've got here is sometimes that little wing that the strap attaches to at the back there is rubbing on the inside of the cheek, and the patient finds it bothersome. So what do? Heat it up with a Flameless Torch, put a little bit of pressure on there and just let it cool down. So watch the next video here and you'll see very quickly. And we're talking just a fraction of a mil, not a huge amount. It's amazing how little it moves, but the patient will notice a huge amount of relief. Now, typically, if they are patient, it'll go away and become a non-issue. But you know, you have some patients that are just more, I'm going to say, delicate. And so if you could do something to make their getting used to an appliance easier, this is easy to do and it works very well. Okay. Now, I guess there is one more final tip here, and that's to do with cleaning. This Novident material works fantastic, but be careful. Sometimes, and this varies, and I have no idea, I've not been able to figure out exactly why. In some patients, there's a white buildup inside the appliance that will lead to decalcification of the dentition. And if they are using this material, then what I advise them to do is once a week, take the toothbrush and clean the inside of the appliance well so you don't get a buildup of this white residue. I've talked to Novident about it. They don't know why it happens. I don't know why it happens. I've never spoken to anybody that has any logical explanation. It varies from patient to patient. In some patients it happens, in others it doesn't. And I've not been able to figure out any trend, like they're not changing the material often enough or whatever. I've not been able to come up with the reason, but it's an easy fix. You just clean the inside of the appliance with a toothbrush. I don't advise using the toothbrush on the outside of the appliance because it's highly polished. But on the inside, you want to keep that film from building up. Okay? So to final things here, just to finalize, a little review of the appliance itself. CAD-CAM, precise, consistent production, facilitates quick modifications. Type 12 organic nylon material, polyamide, biocompatible, light, very smooth. The Panthera people do a wonderful job polishing it up. Strong yet flexible and highly durable. Bruxism resistant, metal-free design. Large titration range, 9.5 mils in 0.5 millimeter increments. Maximized tongue space, allows speech and drinking. Allows mouth opening, but promotes jaw closure. Good combination. Allows for anterior discluding element, minimizing masseter and temporalis muscle activity. No anterior contact with the teeth, or if you want anterior contact with the teeth, you can order that version of it. Retention uses undercuts that are naturally there rather than ball clasps. No premature posterior contact. This was a godsend when they started changing the design so the lower plateau did not go all the way back, because routinely I would have to adjust back there to stop that premature contact. The moment they started doing this, that problem went away completely. And traction-based device on the occlusal plane, engineered to minimize TMJ pain, muscle fatigue, and forces applied to fragile teeth. I'd like to just show this, stdacademy.com. These are free resources. There's hours of content available here about all sorts of different important and timely topics. And of course, the More Practical Pearls ebooks, which is all about CAD-CAM appliances, both nylon and milled. That's a free download for you to check out. And that's all I have, folks. Thank you.
So much. I'm going to put up a poll and then we're going to pass it over to Andreas. Okay, here we go. Are you comfortable prescribing, delivering, and titrating nylon appliances? Give it a few seconds. Okay, I think we're up. We have about half yes, and half could use, well, less than half could use some additional information, and a few said no. And one more question. Are your team members trained in oral appliance therapy? Okay, so we've got about 30% yes, 45% no, and could use access to additional training, about 24%. What we're going to be having early next year, we're going to be having a team webinar, so that'll be a good opportunity. And now, Andreas, how are you doing? Jessica?
I'm here. I was
Okay.
stopping the poll. Andreas, I just asked you to unmute. There you go.
Video, and we're back. Right, everybody can see me?
Yes, we can.
Okay, perfect. So thank you, Dr. Viviano. As always, very interesting presentation. Thank you very much, and very informative. And I hope everybody learned a lot. And as I said, Dr. John Viviano is a walking encyclopedia when it comes to sleep. And thank you, John. Really great presentation.
Thank you, Chris.
So what I'd like to do is just do a summary of what we heard today, and a little bit, just a little bit more information on working with Panthera and doing a nylon device. So just to go get my, right. So some requirements that we do need to be able to manufacture the ultimate appliance for you is we need either a scan or an impression of a complete dentition.
Hi, Andreas. I'm
Hello?
sorry to interrupt. We're not seeing your screen.
Oh. Do you have it? Do you have me? Do you see it in?
No.
No?
Yep. If you want to go down to the bottom.
Yeah, I had it on share screen. Let me go back.
There you go. There you go. Almost in slideshow mode.
Yeah. And I just need to remove that. Right. There we go. Okay. Can you see it now?
Yes, we can.
Okay, perfect. So what do we need from you? We need a impression or a scan of a complete dentition and free end saddles. So not just finishing off at the last molar. Please try and capture as much as you can beyond the last molars. As Dr. Viviano explained, we do take the retention on the mandible specifically. The triangulation is positioned at the first or second molar, sometimes even a little bit further back. So we really need to get maximum impression or scan beyond the last molar. And we need at least 3 millimeters below the gingival margin of the teeth. So make sure that you capture a little more than just the gingival margin. Just some of the common mistakes that we see from clients when they send us scans. So please make sure you capture at least 3 millimeters below the gingival margin. That's really important with the design of the DSAD. It's important to have that extra extension. The second one, you'll see the scan was great, except it was missing a bit of the scan beyond the last molar. So please make sure you capture beyond the last molar. And when you send us a scan, please make sure you send it in the highest resolution possible, because it really gives us an opportunity to create a better fitting appliance for the patient. When it comes to the bite, obviously we need space for the appliance. So please make sure that you take a bite with at least 4 millimeters opening in the molar region. In protrusion, not in centric, either in protrusion desired or maximum protrusion. It really depends on the clinician's choice, where the patient's comfortable, but it has to be in some sort of protrusive bite. The second picture, you'll see the bite. It's in protrusion, but not enough opening. We do need at least 4 millimeters in the molar region. When you receive, so these are our new rod packs. These are the 3.0 rod packs. And what's really great about this is you're going to receive 20 pairs of rods, including 0.5 millimeter increments. So you're going to have a whole range of titration available for your customer, for your patient. So there's more freedom for titration and adjusting, more titration range achieved with the same splint, no need to reorder new rods. So everything is available for you with the delivery of the appliance. And these are custom made. There are still custom made rods available for you. If you want specifically a certain length, you'll just need to reach out to your preferred partner lab and they'll be able to get them for you. If you look at the rods, they do have the number printed on, and we do have a new sheet that you get with each case now just to indicate the length of the rods. The rods are made from the same material as the appliance, which prevents elongation of the rod, so we don't lose the titration as we're putting a patient into a certain titration. Because there's no elongation of the rods, that patient stays in that titration. And again, it's a type 12 natural polymer. There are various web resources for you to look at. If you go to our website, pantherasleep.com, there are all the guides and protocols for taking bites, for taking impressions, adjusting the appliance, inserting the appliance, changing the rods. There's a whole array, of demonstration videos, again, for you to watch from starting from patient selection all the way down to fitting and adjusting the appliance. And there are handouts available. Please just reach out to your local DSG rep and they'll be just too happy to provide you with these handouts. So in summary, we have, obviously, as Dr. Viviano had mentioned already, we have objectives, treatment objectives, and the DSAD really fulfills most of, if not all of these objectives. Efficiency, because of the precision of the appliance, it's an optimal fitting, one visit for the patient. Natural undercut for retention, it's adjustable, precise, and a stable titration. It's small and very low in profile, so it's possible for bilateral contact. Compliance makes it, because the appliance is very comfortable, patients in compliance. Very convenient compared to a CPAP. It's an extremely easy appliance to handle. It's a proven efficacy, minimizes side effects, minimal tooth movement. As Dr. Viviano said, there is tooth movement, but we try and minimize it as much as possible. Minimal articular constraints, minimal occlusal impact, and minimal muscular constraints. So without further ado, I'd like to open it up for any questions. Thank you very much, everyone, for your time tonight, and any comments and questions, and I'll hand it back to Joanne.
We've got quite a few questions, and I think Andreas has answered some of them. The first one, can you hear me? Yes?
Yeah, yeah.
Is there a coating on the appliance after printed from PA12?
Yeah.
And
So,
Andreas?
So no, there is no coating. The appliance, when it comes out of production, it's the production process. So it's laser sintered printed, and there's no coating. The appliance, when you receive it, it's just highly polished. So it's a whole polishing and process that we use to get it to the finished stage.
Andreas, if I could just reinforce the importance of not using a toothbrush on the appliance, because it is very nicely and highly polished by the Panthera folks. They've just recently actually got new equipment to do polishing with this new facility. And so you don't want to be scratching it with a toothbrush. Any toothbrushing would be on the inside of the appliance to make sure you're not having a buildup of the Novodent. So I just wanted to make sure that people, understood that the outside is sacred. Don't use a toothbrush on it.
Correct. Correct.
Is it if it's highly polished, is it still porous?
No, it's so the highly polished really is a surface treatment, but the nature of the production, the laser sintered melting, it makes it extremely dense. So the surface texture that you may see on the appliance, it's just the nature of the printing, but it's a hydrophobic material, so there's no oral absorption, no fluid oral absorption, and the polishing really, it makes it a smooth finish. So no, it's not porous.
Next question is, why are the straps not flexible?
Good question. So our philosophy is when the doctor titrates a patient, we'd like to keep that patient in that position. So having an elongated rod means that as the patient elongates that rod, they're going to lose that titration.
You asked, Andreas.
Someone would like
that's
to.
fine. That's fine.
Someone would like us to show them how to change the connectors. And once again, your local DSG rep, or I can show you on Zoom as well, or Veronica can show you on Zoom. It's really easy. You just turn it, you line it up, you pull it out. If I can do it, anyone can do it. Very, very easy.
You know, I have to say that it's, there's a little bit of a trick to it, but it's not complicated. But once you've got it sorted, it's easy. You know, I never have a problem once I explain to patients how to do it and I give them some straps to move forward. I never have a problem with them coming back saying I couldn't do it. You know, so it really is easy to teach people how to do that properly.
So just to add to that, on the handouts that DSG has for you and also on the website, there's a step-by-step guide on changing the rods. As Dr. Viviano says, it's a really simple process.
Great. What is the heating device required to make retentive improvements?
So that's a flameless torch. I'm pretty sure that's what they're referring to. It's used in the automotive industry quite a bit. So they use it to put the little rubber sleeves over wires, and then they heat it up and it shrinks up like it's a shrimp, like facilitates the shrinking of the rubber to seal the wires. And so if you go to a website and I'm sorry, like Amazon or any type of automotive type of website and look for flameless torch, that's where I got mine online.
Do the straps stretch? How fast? Does the knob that attaches the rods to the appliance break off?
The answer to all those questions is no, the straps do not stretch. They don't stretch, so how fast? They don't stretch. And does the knob that attaches the rods? No, they don't break off.
Now, if I could say something here, that there's been an evolution getting to these new straps. So the newest straps, I've noticed a material change in this issue about breaking, stretching, the knobs breaking off, but compared to the previous straps, which it's been, I guess, about a year and a half now. I think it was April of 2019, I think that the new straps were introduced. And so with the new straps 2.0, you basically, what I was told at the time, that this should take care of 99.9% of bruxers. And I can honestly say, huge improvement over the previous straps. And before, there was like the regular strap, the little B and the big B, all, you know, a lot of effort has been put in to try and come up with a strap that would be, and this latest version, as they've done a wonderful job with it. So that's a special thank you to Diane.
Yes, so the straps, I mean, as Dr. Viviano said, I mean, the latest straps now, the 3.0, the ones that you get with your appliance now, I mean, those are the new and advanced straps. So those will cover most of your cases.
Yeah. Now, let me ask a question myself, Andreas.
Yes.
So I referred to 2.0 because that was in April 2019. Now, this latest straps that you just held up literally came out in the last few weeks. So it's kind of new to me too. Yes. I've got a couple of cases in the office, but I have not had much experience with them. Are they basically even a step up from the 2.0 as far as durability and everything? I know you keep learning about, you know, what's happening. So they have been changed materially from the 2.0. It's not just that they went into this little grid thing. They've also modified the straps as well.
Correct. Yes. So
well, already with 2.0, you made a much better strap. So if these are even better to that, that's really great news.
Correct. Yes, so yes, this is an advancement on the 2.0.
Okay. Can John state the design he likes to use again to minimize diastomas? Also, do you get opening of posterior interproximal contacts?
Yes. So as I mentioned, one of the forces basically is upward lifting of the posterior mandibular area. You know, if you go to open your mouth, that's the first place it's going to peel off if there's inadequate retention there. So what that means is basically the force is to come up. So if there's adequate retention, it won't come up. So because the nylon is in between the interproximals of those molars back there, that force that's pulling up like that, the pulling up force, I believe, it's just my opinion, leads to the opening of contacts in the molars in the back. I have it in my mouth. I've seen it multiple times. Small price to pay for the help I'm getting, so I'm not worried about it. But that's what I personally believe is happening. As far as which anterior band I like to use, I like to protect the palatal and the lingual of the teeth. So I want the strap that is running along the palatal and the lingual wrap over the incisal onto the facial, not necessarily all the way up, unless that level of rigidity is needed for retention. Even just a wrap around the incisal is typically enough to take care of most cases, I find, for retention. And now my teeth are protected from any possible tongue forces.
Okay, Dr. Sophia, when you're titrating the appliance, how many arms come with the Panthera to keep it in that position?
Okay, so so you'll get a whole range of rods, but I'm assuming just to keep it in that specific position. So it's only going to be the one length, but really with the new rods, they're not going to elongate, and very, very rarely that they break. So there's no need to have a spare rod in that position. If you do, contact your DSG rep and they'll provide you with some more rods. But it's highly unlikely that you're going to need them.
Question is, are the straps backward compatible? I'm not sure I understand it, but
Yeah, they are. Yeah, I don't even have to ask Andreas that. I'm sure they are. It would be wrong for them not to be. No.
Yes. So I'm assuming to move the patient back as well, right?
Well, I'm assuming that the previous straps or the new straps will all work on the same devices.
Oh yes. Oh, absolutely.
Yeah.
Yes.
Oh, okay.
Yeah.
When the appliance is delivered, what length straps are used? Is that the length that you have determined should be the first to try based on the impressions?
Correct. So depending on the bite that you provide, if it's a maximum bite that you've provided, Panthera will normally take it back 4 millimeters from that maximum protrusion. And that's the strap that will come with the appliance when it's delivered to you. And of course, with the whole range of other rods. So yes, it really is dependent on the bite that you provide.
Does wrapping the distal on the mandibular molars help minimize those open contacts?
Dr. Viviano?
Yeah, I really can't say. I don't have information on that, whether it will prevent it or not. I mean, theoretically, it will, but I mean, I really don't know. I don't have the answer to that. I don't know that anybody really realistically does. There's a number of appliances out there, like for instance, if I can mention, there's another major brand that's just come out with an appliance recently, and it doesn't come with a distal wrap. And so, you know, when the dentists in North America are asking them, and their answer is, and this is a multinational company everywhere, you know, their answer is that basically, like everywhere else in the world, and 21 other countries we are in the world, nobody asks for the distal wrap. It's only you guys in North America who are asking for the distal wrap. So I don't know. I don't know that the distal wrap really makes a difference, or if that's just a comfort thing. I don't know that we have any proof on that. Or evidence, you know.
What does it mean by proprietary software? Is it for design or for manufacturing? Does EOS print for you or in-house printed PA12?
So the proprietary software really means it's software that we've designed. What a lot of companies do is they buy software that's not from the industry, or they use software that's already in the industry and they adapt it to their needs. What we've done at Panthera is we've actually designed the software for our own needs. So everything that we have as far as the software goes, it's designed in-house by our own engineers and software developers.
Does that upward posterior force also cause an anterior open bite? Oops, that disappeared. Well, go ahead and answer that part, I guess.
So upper posterior, are you talking about the oblique?
Oh, here we go.
With the herps, or is that what you mean? Or
I think, you know,
My
that
apologies, I'll jump in. Does that upward posterior force also cause an anterior open bite in some cases?
well, anterior open bite can be caused for a number of reasons, so I'm not quite sure what they mean by posterior upward force. The only thing I'm thinking, are they talking the oblique herps style of compression, right? And so what I can tell you, what we do know from the literature on with the oblique compression style is that it causes distally movement of the maxillary molars and intrusion, and anteriorly moving the lower incisors and intrusion. And if you think about it, the forces are going that way, and it's actually flows. I mean, we can't cheat physics. That's why all those force vectors and everything that I show, there's people that don't take that seriously at all. And I really don't understand that, because we've had 150, 200 years of orthodontics that we use to move teeth around, and we think that we're going to put oral appliances in that are putting forces on the teeth, but it's not going to move teeth because the appliance is made CAD-CAM. I don't think so. You know, like, forces are going to move teeth, right? It's just a matter of how much they move them. We try our best to make appliances that minimize, you know, tooth movement, but there will be subtle forces, and when there's a subtle force, a tooth will move eventually. If a CPAP strap can move a tooth through the cheek with given enough time, an appliance on the teeth with forces is going to move the teeth also. So we have to get over this and not worry about it so much, and, you know, try and minimize. And the appliance manufacturers are doing a wonderful job, all of them, at trying to minimize this type of tooth movement.
Are there any other 3D materials like carbon 3D, no porosity? Andreas, do you have any answer for that?
I'm not aware of it, but I know that the nylon is probably the most popular 3D printed material on the market right now. I'm really not aware of any of the other manufacturers having a 3D printed appliance other than nylon.
It's the only material that I'm familiar with right now as well. I think there's probably going to be other materials coming up. I'm not sure if there's anything superior to the type 12 polyimide nylon. I mean, you saw the list, and, you know, that list I found back in 2013 on the industry side, nothing to do with dentistry. I mean, that you saw the characteristics of this material. It is perfect for an oral appliance. So maybe there is another material out there that's superior, but I've not heard of any yet. I think there's a reason why all the new 3D printed appliances that are coming along are with this type of nylon. Not to mention other names, but, you know, as the list starts to pile up of other nylon appliances, or I'm sorry, 3D printed appliances, it seems like this is the material of choice. So it'd be interesting to see if something else comes along, but right now I'm not familiar with any others.
Sorry, can't hear you, Joanne.
Can this appliance be used with CPAP? Does it help, and is it used?
John?
Well, I mean, combination therapy of CPAP and oral appliance it can be done with any appliance. And of course, you know, one could use the argument that this appliance encourages jaw closure, and it's a minimal intrusive because it's so small. So perhaps, you know, that would make it one of the more ideal appliances. But, you know, you can combine CPAP with any appliance out there, truthfully.
Do you find that patients can end up with an open bite posteriorly? Can you discuss the morning repositioner device?
Okay, so there's two reasons for posterior open bite. One of them is going to be a change in tooth position, which now they're touching prematurely in the front and the posterior is not touching. Or the other is jaw anteriorization. So, you know, the jaw's held forward all night long, so in a sling, You take it out. If the patient isn't stretching things out and bringing their jaw back and reclaiming their bite, muscles are dumb. They'll do the least amount of work, you know, possible. So they come back, but they don't come back quite all the way. So on a very small basis, the jaw slowly starts to anteriorize and stay further forward. And eventually now it's touching on the front rather than the back, right? Because you've come to that point. Once that happens, it's really tough, you know, to get the jaw to go back. So it's important to get them to do the jaw stretching exercises and to help to try and minimize this type of change. With regards to the morning realigner, or any one of a number of different names you can give it, you know, Alan Lowe's opinion on this, he is very concerned. Now, he's been retired now for about 3 years, but I think his opinion matters because he's an orthodontist, been in the game a long time, done a lot of research, published more in the medical literature than anybody else on oral appliance therapy. So I think his opinion matters. He has very serious concerns about use of something that is going to push the teeth one way, and every night your appliance is going to push the teeth the other way, and the long-term consequences. The truth is, we don't really know what the long-term consequences of being so concerned about that and having this back and forth type of pressure on the dentition. I use a morning bite jig, but I use it selectively. If I'm dealing with a patient that's in an extreme class 2 and a little bit of anteriorization or a little bit of tilting of the teeth is not going to lead to a posterior open bite, then I don't bother. I just explain to the patient, your jaw might end up staying, it might be bite changes, but you know. But if it's somebody that is very prone to a posterior open bite because they're already very tight and it won't take much at all before they're just touching like this and they're not touching in the back, for that individual, I will tend to use that. So it's a trade-off. Well, you know, we really don't know what the long-term, but short-term, we know this is going to be an issue. So let's try and prevent that from happening. So I use it selectively personally.
Do you ever feel at a loss for choosing to make the appliance out of nylon because you can't repair it?
Never. Nylon is very durable, strong material. I think Luke proved that to all of us back in 2014, and I've not seen any evidence since then that that was a one-off. You know, I mean, I've had multiple cases where a dog is attached to a nylon appliance and it survived, where I know if that, and I could see by the teeth marks on it, if it was an acrylic appliance, it would not have. So it definitely withstands a lot of damage capability. Now, the bottom line is this, you know, it's a trade-off, but it's small, it's comfortable, and it's durable. And you know, it would be an issue if it didn't last, but this is 2020 and we've been making them since 2013. They last, you know, so it's not a problem that it's not repairable.
Can this appliance house nasal pillows attached to wires for those with upper airway resistance syndrome?
So no, those nasal pillows are found on the Oasis appliance. They're, you know, for a short period of time, they were put on another nylon appliance offering from the US. I won't mention a name. And he was told, well, you can't use that because I have a patent on it, being, you know, the Oasis people. I'm not mentioning any other names there. Bottom line is that the nasal pillow attached to the appliance is patented by Mark Abramson, and it's available on the Oasis appliance. So there is no nylon appliance that can incorporate that feature unless it's bootlegged.
So then somebody says that Carbon 3D just introduced a new material for splint that is FDA approved. And I think it's the same person that says, may look into this flexible splint with the effectiveness of a hard splint exclusively available on Carbon. Well, I think that DSG already has that splint. And if you get in touch with your DSG rep, we'd be happy to give you the information about that. Are patients with class 3 skeletal relationships and class 3 dental relationships more difficult to treat because they can't come forward too much?
Well, I don't know. I mean, the class 3 patients that I've come across, I don't know why I don't see too many class 3 patients. I'm not sure, but I have not seen a lot of class 3 patients. But I have seen class 3 patients, and it's never concerned me. And we've gone ahead and made an appliance, and it's not, excuse me, being an issue at all. So I don't find that class 3 patients have less of a range of motion typically than a class 2 patient. Just because somebody's a class 2 doesn't mean they're going to have a huge range of motion versus somebody's a class 3. It's just that, you know, whenever they're fully protruded, they're going to look a lot funnier because they're further out, because they're already starting out, you know, out there, right? But it doesn't mean that they don't have that movement available for them. And now keep in mind that a good part of what an appliance does is basically stopping the jaw from dropping back. So, you know, for a particular patient, just putting an appliance in and stopping that patient from being able to drop back when they're on their back, it may be all they need. Maybe they just need a little bit of advancement. So very little advancement ability is never a reason not to try an oral appliance.
Do you think these appliances will become modular? Not sure what that means either, but maybe you do. Andreas?
No, I'm not sure what the questions. I'm not sure about the question.
If
You
the
mean like
person
IKEA? Like, sorry, I don't understand.
if the person who is still on, please enter it in the chat and we'll ask it again. And we're getting to the last 2 questions. What would you do differently with the design if they have large tori? Can the nylon rest on the hump of the torus, or does it have to stop above the hump?
Talking about the torus palatinus? Or?
I mean, this appliance doesn't run up onto the palate, or it really engages the dentition, and you need to have 3 millimeters of detail beyond, you know, the margin. That's, you know, to be able to manufacture the appliance properly, but it does not encroach on tori anywhere, basically. As a matter of fact, one could argue that it's particularly good appliance because of that. There's no bulk of acrylic that may, you know, interfere with a tori somewhere.
So the appliance doesn't cover the palate at all.
Yeah.
They're talking about mandibular tori.
Even
though.
mandibular, because see, it's thin. The appliance is thin up against the tooth, doesn't encroach into the mouth very much. So it's not like an acrylic appliance that needs to have a certain amount of thickness that might then be bumping into the tori, or you know, even the mandibular tori. So no, if anything, it's probably a particularly good appliance for that type of situation.
Mm-hmm.
This may have been answered already. Can you add parts like the nasal pillows or something to bring the tongue above the torus?
No.
Nasal pillows to bring the tongue.
Or yeah.
Oh, you mean like, you mean tongue pillows?
Oh.
So tongue buttons, I should say. So once again, so this person, if it's the same person, is talking about features that are associated with the Oasis appliance. Now, that same appliance that is being told they cannot put nasal pillows can use the tongue buttons. You know, so their appliance is available with tongue buttons. But no, I right now, this is not something that Panthera people that I've looked at that I've heard of. Andreas, that might be something to consider, because if they're doing it, then you know, you should be able to also. I don't believe there's any patent infringement there. But I just don't know. I've only placed those types of buttons maybe 4 or 5 times in my life, so it's not like I have a ton of experience to be able to talk about how effective they are.
Okay, and
So yes, I mean, it probably is possible. It's just something we've never had a demand for.
This is one thing I'll say, is that this company, and you know, truthfully, I mean, the ProSomnus folks also the same type of thing, because of the environment they work in, very responsive to end user requests. So this is obviously not a request that has come up often. Otherwise, I'm sure the Panthera folks would have incorporated it in. So if there is an interest in this type of thing, let the company know, you know, because I know that they have been very responsive over years to all sorts of enhancements and features based on, you know, end users' requests.
So we'll close it out with this interesting question. I don't know who wants to handle it. Why did Narval stop selling, I guess, in North America? What's the short answer?
Follow the money. Okay, so the short answer basically is it's a publicly traded company. They tried very hard to get the Nylon appliance to be covered by Medicare. Doesn't qualify for Medicare coverage because it's a new world appliance, if you will. And it's, you know, there's certain criteria that the herps, for instance, satisfies. And Medicare wanted no part of it. And when ResMed finally came to the conclusion that no matter how much money they throw at this project, they're not going to get Medicare to change their mind, they decided they'll never be able to make enough appliances to keep their shareholders happy. And so they aborted on North America. But of course, in countries where they continue to be covered by insurance, right, where they are making enough units to make it profitable for them, they continue to make the Narval. So it's about money, has nothing to do with how good an appliance the concept or that nylon is or horizontal traction is, has nothing to do with any of that. It has to do with the green.
Okay. So this is the very last question. When the mouth opens while asleep, is it on their arc of opening and closure, or is it holding the lower jaw forward like when it's closed? Get that? When the mouth opens,
yeah.
When the mouth opens while they're asleep, does it still hold the jaw forward like when it's closed?
Yeah. So just picture putting your jaw forward and then open it at that position. And you're opening at that position, not at your back position, right? So that's basically what's happening because your jaw is still being held forward, but you're dropping open at that forward position. Okay, the good news is that honestly, I do use elastics on some of these patients with this design, but just not very often because most of the time the jaw closing tendency of the appliance is enough to keep the jaw closed, as opposed to a Herbst appliance, which, the force is downward and forward. Well, where do you think the jaw is going to go? If the upper, if that rod is pushing on the mandible downward and forward, it's going to open the jaw. You need to put elastics on that appliance in order to keep the jaw closed. So that's the difference.
Thank you very much. Thank you, everybody, for sticking around for our 30+ questions. And Dr. Viviano, as usual, unbelievable presentation. Jessica, do you have some last words? Andreas, thank you very much.
Thank you.
Jessica, are you there?
I do. Thank you, everybody, for your attention today. And somebody said these talks are so helpful. Thank you so much for your commentary. We are looking to develop additional content with Dr. John Viviano and Panthera in the future and create those engaging back and forth discussions because we love this input. We love this feedback. We need to know what you want to know. So with that said, just want to share screen really quick. We've got some fantastic additional practice management webinars coming up in partnership with Konica Minolta, IT as a service, enhancing the patient experience with the digital front door, cyber secure, and minimize wasted time for maximum benefits outcome. To roll out the rest of November, we've got iTero digital scanner, tools and efficiencies for your entire practice, as well as digital workflows in the dental office from crown and bridge to implant prosthetics. Take your scanning knowledge to the next level. And again, there is a survey coming out right as we close this webinar and in an email. We want to learn what you want to learn. So please let us know with valuable feedback so we can create that engaging content which you want to hear. And with that, again, thank you, John Viviano, Dr. John Viviano, Andreas Klie, and Panthera for joining us today. for answering all these questions and being here and collaborating with DSG and the audience. Thank you, Joanne and Veronica. And we wish everybody a fabulous evening. Take care.
Thank you. Thank you,
Bye,
everyone.
folks.
Bye-bye.